If you're over 60 and struggling to sleep, waking up multiple times at night, staring at the ceiling for hours, or dragging through every morning like you barely slept, you're not alone. But here's the hard truth. You're probably making one of three critical mistakes that are sabotaging your sleep, your testosterone, your immune system, and even accelerating the aging process. My name is Dr. Narita, a urologist with over 12 years of experience. And today I'm going to show you exactly what these mistakes are, and more importantly, how to fix them starting tonight. These aren't complicated prescriptions or expensive devices. These are simple, practical habits that make a massive difference once you understand them. Before we dive in, take a second, hit that like button, and leave a comment telling me where you're watching from. I love seeing all the men around the world taking control of their health. Now let's tackle a dangerous myth. Poor sleep after 60 is not inevitable. Yes, your sleep naturally changes with age. Deep sleep stages decrease. Your body becomes more sensitive to disruptions and circadian rhythms can shift. But the severe sleep issues most men over 60 experience, waking multiple times at night, feeling exhausted all day, brain fog, irritability, are not normal aging. They're caused by specific fixable habits. I see this every day in my practice. Some of my patients at 75 are sleeping 7 to 8 hours straight, waking refreshed, full of energy, and thinking clearly. Meanwhile, 62-year-old patients struggle with constant wake-ups, fatigue, and brain fog, sometimes for years. So what makes the difference? It's not genetics, luck, or sleep destiny. It's three specific mistakes. Here's why this matters. Poor sleep after 60 is more than just feeling tired. Lack of quality sleep lowers testosterone, which reduces muscle mass, libido, and vitality. It weakens your immune system, making you more prone to infections and slower to recover. It increases inflammation, which accelerates aging and worsens chronic conditions. It raises cardiovascular risk and blood pressure, and it disrupts cognitive function, memory, and focus. Put simply, if you're not sleeping well, your body can't heal, recover, or function at its best. The good news: all three of these mistakes are completely fixable. And when you correct them, most men see dramatic changes within just 1 to 2 weeks. Sleep becomes deeper, testosterone recovers, energy returns, and you start feeling like yourself again. So if you're ready to stop being tired all the time, stay with me. I'm about to reveal the three biggest sleep mistakes men over 60 make and exactly how to fix them. Mistake number 3, drinking fluids too close to bedtime. Let's start with the most common and often overlooked mistake: drinking too many fluids in the hours before bed. I see this in almost every man who complains about waking multiple times during the night. Here's the problem. After 60, bladder capacity often decreases. The bladder muscles become more sensitive, more reactive. Even a small amount of fluid in the evening can trigger urgent nighttime trips to the bathroom. Every time you wake up to urinate, multiple things happen. Sleep cycles are interrupted. Deep sleep and REM sleep, the most restorative phases, are broken. Cortisol spikes and your stress hormone increases, making it harder to fall back asleep. Body temperature shifts. Getting out of bed changes your core temperature, further disrupting sleep. And mental alertness increases, meaning your brain partially wakes up, making it difficult to return to deep sleep. Many men think drinking water in the evening is healthy and harmless, but for sleep, it's a trap. There's also a second hidden factor. Plain water is less hydrating than mineral-enhanced water. Water without electrolytes passes through your system quickly, triggering more urination without actually hydrating your cells efficiently. Here's what to do instead. Front-load your hydration by drinking 64 to 80 ounces of water between morning and 60 in the evening. Your body needs water most during the day. After 6, take only sips if genuinely thirsty and avoid full glasses of water or tea. Add a pinch of high-quality sea salt to your daytime water, as trace minerals help hydrate cells more efficiently and reduce the total fluid your body needs. And before bed, take your time emptying your bladder fully. Don't rush to minimize wake-ups. When men make these changes, the results are often dramatic. Waking 3 to 5 times per night drops to 0 to 1 times within a week. This one habit alone can transform sleep quality overnight. Mistake number 2, magnesium deficiency. Now let's talk about magnesium, the master mineral for sleep. Over 75% of men over 60 are deficient, and yet it's critical for falling asleep, staying asleep, and getting deep, restorative sleep. Magnesium regulates your nervous system. It helps switch your body from fight or flight into rest and digest mode. Without it, your nervous system stays hyperactive, you feel tired but wired, you struggle to relax, toss and turn, and wake frequently. Magnesium also regulates GBA, the calming neurotransmitter that quiets brain activity and promotes deep sleep. Low magnesium means low GBA, which means poor sleep. It even affects melatonin, your natural sleep hormone, and reduces cortisol at night. High cortisol destroys sleep and suppresses testosterone. Magnesium helps fix all of that. Signs you might be deficient include difficulty falling asleep, waking repeatedly at night, restless legs or cramps, muscle tension or soreness, racing thoughts at bedtime, and anxiety or irritability in the evening. Why are men over 60 so often deficient? Magnesium absorption decreases with age. Common medications like diuretics and PPIs deplete magnesium. Stress consumes magnesium rapidly, and modern diets are low in magnesium-rich foods. Here's how to fix it. Take 300 to 400 milligrams of magnesium glycinate 30 to 60 minutes before bed. Glycinate is gentle on the stomach and promotes relaxation. Avoid magnesium oxide as it is poorly absorbed and can cause digest issues. Combine it with B6 at 25 to 50 milligrams to enhance GABA production and support magnesium function. And eat magnesium-rich foods like dark leafy greens, almonds, pumpkin seeds, avocados, dark chocolate, and fatty fish. The effects are often immediate: falling asleep faster, staying asleep longer, waking feeling refreshed, fewer leg cramps, less anxiety, and a calmer mind. Many men call this the single most powerful sleep habit they've ever adopted. Mistake number 1, sleep environment and circadian rhythm. Now, the most damaging mistake, the one that affects every single night: neglecting your sleep environment and circadian rhythm. After 60, you become more sensitive to your environment, things that didn't bother you at 40. Noise, light, temperature can wreck your sleep at 65, yet most men continue sleeping in suboptimal conditions, completely unaware of how it's sabotaging them. When it comes to key environmental factors, temperature is critical. The ideal range is 60 to 67 degrees F or 15 degrees C. Too warm prevents the temperature drop needed for deep sleep. Even small amounts of light, street lights, clocks, TV standby lights suppress melatonin, and blue light from screens is particularly disruptive. Noise sensitivity also increases with age, and even subtle sounds can trigger awakenings. And a sagging or flat mattress and pillow causes discomfort, position changes, and frequent wake-ups. When it comes to circadian rhythm, get 15 to 30 minutes of outdoor sunlight within 1 to 2 hours of waking each morning, as this synchronizes your internal clock. Avoid screens 1 to 2 hours before bed, since blue light confuses your clock and suppresses melatonin. Avoid large or high-sugar meals late at night, as they spike insulin and disrupt sleep. And go to bed and wake at the same time every day, even on weekends, to train your body clock. Here's what to do. Lower your bedroom temperature to 60 to 67 degrees F. Make your bedroom completely dark using blackout curtains or a sleep mask. Reduce noise with earplugs or a white noise machine. Replace mattresses or pillows older than 7 to 8 years. Remove electronic devices from the bedroom and establish a pre-sleep routine of reading, meditation, gentle stretching, or a warm shower. When men optimize their environment and circadian rhythm, sleep transforms. Deep sleep returns, wake-ups are minimal, and mornings feel restorative. Many say it's the best sleep they've had in decades. Here's exactly how to fix these 3 mistakes. Starting tonight, take immediate action. Stop fluids 3 hours before bed. Lower bedroom temperature to 60 to 67 degrees Fahrenheit. Make the bedroom completely dark and take 300 to 400 milligrams of magnesium glycinate 30 to 60 minutes before bed. This week, optimize your environment. Evaluate your mattress and pillows and replace them if old or uncomfortable. Install blackout curtains if needed. Get blue light blocking glasses if screens are necessary in the evening. And establish a consistent bedtime and wake time. Ongoing support your circadian rhythm. Get morning sunlight exposure daily, 15 to 30 minutes within 1 to 2 hours of waking. Avoid screens 1 to 2 hours before bed. Maintain a pre-sleep relaxation routine of reading, stretching, or meditation. And time your largest meals earlier in the day, keeping dinner lighter. For additional sleep strategies, try the 478 breathing technique before bed and keep a sleep journal for 2 weeks, tracking bedtime, wake time awakenings, and morning energy. Consider supportive supplements like vitamin D3, zinc, L-theanine, and glycine, and avoid caffeine after 2 in the afternoon. Here's what to expect. Within 3 to 7 days, falling asleep becomes easier and awakenings decrease. Within 2 to 3 weeks, you'll see significant improvement in deep sleep and restorative cycles. Within 4 to 6 weeks, you can expect consistent 7 to 8 hours of quality sleep with morning energy restored. And within 8 to 12 weeks, the cumulative benefits include testosterone recovery, better immune function, sharper cognition, and improved vitality. I know how exhausting it feels to lie awake night after night knowing tomorrow will be just as draining. I know the frustration of waking up multiple times, never feeling rested, and dragging through your day in a fog. But here's the truth. Poor sleep after 60 is not your destiny. You're not broken. You're not failing. You're simply making mistakes that can be fixed starting tonight. Your body is designed to sleep well. It wants to repair, restore, and recharge you every single night. You just need to give it the conditions it needs. By fixing these 3 mistakes, stopping fluids too close to bed, taking magnesium glycinate before sleep, and optimizing your sleep environment while respecting your circadian rhythm, you can transform your sleep, your health, and your life. Your testosterone will recover, your energy will return, your mornings will feel like they did decades ago, your focus, mood, and vitality will improve. And all of this is within your reach. So here's my challenge. Start tonight, make these changes, be consistent. Monitor the results, watch your sleep improve dramatically within weeks. If this video helped you, smash that like button, subscribe to the channel, and drop a comment telling me which mistake you're fixing first. Share your wins. You'll inspire others too. Remember, great sleep after 60 isn't luck, it's a choice. You have the power to reclaim restorative sleep, strength, and vitality. My name is Dr. Narita, and I'll see you in the next one. Take care, protect your health and sleep,